Time for medical rounds. Studies suggest that migraines are often undiagnosed or inadequately treated in the primary care setting. Many women consider their OBGYN to be their primary care physician. But do these practitioners understand migraines? Well, a team of doctors at Hartford Healthcare recently did a study, and their findings are getting some national attention. Joining us now is one of the authors of this study, Dr. Amy Johnson, an obstetrician gynecologist at Hartford Hospital. Dr. Johnson, thank you so much for being with us.
Good morning, and thank you for having me today.
Well, give us a little background on this study and what was the whole objective of this?
Certainly. So this was a collaboration between the Hartford Healthcare Headache Center and women's healthcare providers across the state of Connecticut. Migraine is a very common disorder, and it disproportionately affects women 3 times more than men. And this is really felt to be related to hormonal changes that women experience throughout the reproductive cycle. And we know from prior studies that the majority of migraine care occurs in the primary care setting. But as you said, many women rely on their women's healthcare providers for primary care services. However, no one's ever really queried what their practices are within this setting for the management of migraine. So our team set out to assess both women's healthcare providers' practice patterns and their prior training and comfort with the management of migraine in an effort to further develop collaboration with women's healthcare providers throughout the state and hopefully optimize headache care for patients within our community.
So some challenges appear to come in prescribing migraine-specific and preventative medications for these, the same patients. What did you find with all of this? I mean, it's a really specific thing. What did you find with that?
Absolutely. So we were able to survey about 115 women's healthcare providers across the state in various practice situations. And we found that of these providers, they were providing primary care services to 1/3 of their patients. And fortunately, the majority of these providers were very comfortable in making the diagnosis of migraine. Only about 60% of women's healthcare providers, however, are routinely prescribing initial medications for the management of migraine. And a very small percentage of women's healthcare providers are actually routinely prescribing preventative medications for migraines or migraine-specific medications. In addition, we found that there were low referral rates for non-medication modalities, such as cognitive behavioral therapy, relaxation training, or biofeedback, which are treatment modalities that have been shown to be very effective in the migraine management.
So what's your advice in all of this for women who suffer from migraines?
Well, overwhelmingly, we found that women's healthcare providers are interested in learning more about how to manage migraine and treat their patients within the community. And we certainly want to encourage patients to continue to reach out to their primary care providers and their women's healthcare providers for their initial diagnosis and treatment. We hope to continue to collaborate with the women's healthcare providers across the state to further develop our referral process and to enhance their education. However, if patients are finding that their treatment is ineffective or they are having trouble finding the appropriate provider, then it may be time to reach out to a headache specialist.
All right, Dr. Johnson from Hartford Hospital, thank you so much for being with us today.
Thank you for having me.
All right, for more information, visit hartfordhealthcare.org/headache.